Dr. Sanjeev Kumar, a critical care and practitioner in Kolkata. I have various attachment in which GNRA is mainly I am attached with GNRA Hospital and Charnak Hospital. Today I am here to discuss about the antihypertensive medicine, which is commonly used in a patient with hypertension and diabetes. That means CCB and ARB combination. CCB and angiotensin receptor blocker ARB are among the most widely used antihypertensive drugs. ARBs are administered in combination with agents such as calcium channel blocker to reduce the risk of CVD and renal disorder. In patients with diabetes, CCB are potent first-line blood pressure lowering drug with minimal contraindication. Here, I'm going to discuss about the CCB for which cilnidipine is recommended from my side because there are some other calcium channel blocker which having amlodipine. But with this topic, I will discuss the difference between cilnidipine and amlodipine. Cilnidipine is a novel and unique dihydropyridine CCB that has inhibitory action on both L-type and L-type calcium channel. Intracellular calcium overload is associated with atrial fibrillation. Cilnidipine restricts the overload and activate eNOS with regulate cardiac function. According to RSSDI guideline 2022 recommendation of use of ARB and CCB in patients with diabetes and hypertension. CCB are used alongside ARBs as a part of combination therapy for the management of hypertension and diabetes patient. ARBs help to reduce the cardiovascular and cerebrovascular risk and renal complications, hence minimizing the morbidity and mortality risk in patients with hypertension. In diabetic hypertensive patient, telmisartan and losartan are the most effective choice of ARBs to reduce cardiovascular risk factor. Telmisartan must be selected as the first-line ARB agent in diabetic patient because of its beneficial impact on fasting blood glucose and insulin level. In those at a risk of stroke, losartan must be preferred, whereas telmisartan is recommended in patient having a history of atrial fibrillation. That means when you want to differentiate between telmisartan and losartan, you have to assess the clinical condition of the patient with their history of atrial fibrillation or not. If there is atrial fibrillation, you may continue with losartan. Otherwise, you may continue as a telmisartan as first line of drug. And cilnidipine is preferred in hypertensive patients with diabetes because it improves insulin sensitivity through its vasodilator effect. Besides its antihypertensive effect, cilnidipine has improved insulin sensitivity along with various reno-protective and cardioprotective benefits, thus making it the choice of DHP-CCB in hypertension with diabetes. The other difference, as I said earlier, amlodipine and cilnidipine are equally efficacious in reducing blood pressure. However, the incidence of pedal edema are lower with cilnidipine associated than amlodipine. That means if you are developing edema, you may discontinue amlodipine and you may continue cilnidipine because cilnidipine having less edema, incidence of pedal edema after using cilnidipine. When administered at the dose of 5 to 20 milligram a day, based on the patient clinical profile, cilnidipine facilitates BP reduction and help reduce heart rate and serum triglyceride level in Indian patients, suggestive of cardioprotective benefit. That means if your triglyceride level is, if it is around 200, so there's no need to take other medicine to reduce your triglyceride. If you are using cilnidipine, triglyceride level must be controlled with the use of cilnidipine. Independent of blood pressure reduction, 8-week treatment with cilnidipine, 5 to 10 milligram a day dose, improve left ventricular systolic function. Cilnidipine is more tolerable in Indian patients and must be preferred in those with proteinuria and pedal edema. Thus, cilnidipine should be preferred calcium channel blocker in diabetes hypertensive due to its reno-protective and cardioprotective benefit and better safety and tolerability profile over the CCB. Conclusion: ARB are recommended as the choice of therapy, preferably in combination with CCB to manage hypertension and its resulting complication. For combination therapy, newer CCB like cilnidipine along with ARBs are recommended. Cilnidipine is a novel, effective, and safe CCB with established for its renoprotective benefit. Thank you.